Welcome to Nightingale Hospital, the leading private mental health provider in central London with over 25 years' experience. Our dedicated team of consultant psychiatrists, doctors, therapists and nurses work together to support adults and young people with mental health or emotional problems, eating disorders and addictions. We offer outpatient and day patient treatment as well as inpatient care.
I'm Michael Craig, I'm a consultant psychiatrist and I'm really excited to have introduced this treatment to the Nightingale Hospital. As you're probably aware, about a third of patients who suffer from depression don't respond to either several different antidepressant medications or psychological therapy. And TMS now offers a fantastic option for these patients who are looking for an alternative to ECT or other medications that may cause them further side effects. So over the last 10 years, scientists have been trying to refine the technology used in TMS, and here at the Nightingale we're using the latest equipment that has been validated by a large trial involving world centres of excellence, including Harvard and Johns Hopkins. So up until now, the patient group that we're talking about only had one option open to them, which was ECT. And ECT basically delivers a massive electrical shock across the whole of the brain to cause changes in limited brain regions. And what TMS does is focus magnetic pulses at these specific brain regions that we know are important to regulating mood.
My name is Carolina. I'm the TMS practitioner at Nightingale Hospital. My first contact with a patient would be over the phone to go through any sort of questions they would have of the procedure. And I would also ask them some questions to determine their suitability for the treatment. Then I would meet them at the hospital for their first appointment to go through some of the paperwork and also answer some more questions they might have concerning the procedure. Then we would just sort of come in and get started with the treatment. So the patient would have a seat in the chair and I would fit them with their cap. And then I would place the helmet on their head, which you could compare sort of like going to the hairdressers and getting your hair done. Okay, I'm just gonna place the helmet on your head now. The treatment is delivered in 2-second pulses with 20-second pauses in between each pulse, and in total it would be about 20 minutes. What they might experience is a slight twitching sensation in their arm and in their face. The machine does make some noise. Patients have mentioned to me that it sounds like a woodpecker, sort of like a tapping noise. What usually happens is that patients come in 5 days a week for 4 weeks. So you would come in every day for a 20-minute session. So after the 20 sessions that the patient has done, they would meet with their consultant to discuss any follow-up treatment they would like to do, and that would involve coming back in for 2 days a week for a couple of weeks afterwards. After treatment, patients can go resume their daily activities. They could go back to work or even drive a car.
I would recommend the treatment to anyone suffering from depression. It has made such a difference to my life.
I feel much more motivated to do daily tasks that felt impossible before starting treatment, and I've even been able to go back to work.
I have a reason to get up in the morning now. This treatment's made such a positive difference to my mood.
Over the period of time that we've been running this treatment at the Nightingale, it's been amazing seeing the response that some patients have had. People who have had treatment-resistant depression for a long period of time, really getting their lives back together, having the ability to re-engage with hobbies, go back to work, and experience the type of return of energy that we see as depression begins to lift. Looking into the future, I believe that rTMS is going to become a more mainstream treatment for depression and probably other disorders across the UK and the world.
If you would like further information about rTMS or any of the other services available at Nightingale Hospital, do please contact us.